Good morning.
Good morning.
You were referred by your primary care physician about exactly 4 months ago for some symptoms you were having that the neurologists weren't able to figure out, and you had a brain scan imaging that wasn't really showing anything. So at the time, when you first came in and we sat down and talked, you were describing pretty severe body shaking episodes when you would change positions, especially after getting up from lying down. And then you were also having a lot of issue with double vision. In fact, when we were sitting here in your first initial intake, you said I was like, oh, now I see two of you. So you were
Yes.
you had it right then. And then you also described trouble speaking, where you would just lose the ability to talk at times. Can you describe a little more of those symptoms in detail and approximately how long they had been occurring?
I started having balance issues back in 2019, but they became more severe, with more severe symptoms in 3 years ago.
3 years ago.
Yeah, where I would see double and my knees would buckle, and then that was kind of more of a mild, and I called them episodes, to the severe ones where my whole body would shake and I would not be able to walk at all. It usually took two people to help me to even stand up and walk. And they would come randomly. There was a couple of things triggered them. I had noticed where there was a lot of kids screaming or crying, or my body exerting itself sometimes would cause that, or from laying down to sitting up. So nobody could ever figure, all the neurologists I went to didn't figure it out. And then my speech also, I would be talking and not be able to, nothing would come out. And when I would talk sometimes, it was like people that have a stroke, just barely saying 2 or 3 words, could not even speak a sentence. And my voice would sound southern, like I was from down south. It didn't even sound like me at all. So there was a lot of different symptoms and issues going on, to the point where Whitney Paul, my nurse practitioner, suggested that I come here, and I'm very thankful I did.
I did some. Your symptoms were such that I had never really heard of those combination of symptoms before, and I even double checked with your provider to be sure you hadn't had a stroke, because when I did a little research, your symptoms lined up with issues in the central part of the brain called the thalamus. And so I just double checked you hadn't had a thalamic stroke, and she said no. But we started using the light therapy in that part of your brain and a little bit in the cerebellum, and we were even shocked at how quickly you responded. And that was just 4 months ago. And so at this point, you haven't had any of those episodes.
None whatsoever at all.
Yeah.
And it's been probably like 2.5 months
Since you've had it.
Yes.
Yeah.
So the therapies really worked quickly in correcting all of that. I don't walk with the walker, obviously. I don't even walk with the cane anymore.
Yeah.
So I really progressed very, very nicely. Haven't had double vision, weakness of knees, anything.
That's wonderful. Well, we're so glad we got such great results for you.
I am so thankful too.
Thank you.
Can live now more of a full, complete life without having that fear something's going to happen when I go out, or am I going to fall because I can't keep myself up, or and have hit my head and have something more severe happen. So yes, now I have all the confidence.
That's great. Okay. All right, well, thank you.